Haas, you brought up the issue of biopsy post-progression. We have preclinical data to support this. Is this something that you think we should be doing, and particularly out in a community-based setting? Are there enough clinical data to support this, or is this a concept but not backed yet by enough clinical data to use it to guide, to shape practice?
It's a great academic concept. I would really like to do it at an academic setting to be able to learn and deliver personalized therapy. I think when we talk about mutation positive patients or oncogene driver subsets, I do feel that there's so much to be learned with the post-treatment biopsies to be able to advance the field overall. But to your point, I don't believe that we have enough validated clinical experience to guide management in the clinical setting yet.
You just published some very provocative work on liquid biopsies in the clinic for patients with advanced non-small cell. Does the potential to do liquid biopsies easily and even serially lower the threshold for using this, or is this still too premature to really use this, and are we just going to be guessing anyway?
So I think what our study showed was that you could use a liquid biopsy to complement your ability to detect gene mutations in tissue and perhaps increase that ability to be able to deliver personalized therapy. However, we have to be very careful to adopt that approach to serially monitor patients or to generally say that I will be able to use this liquid biopsy to guide the next line in therapy, because we are limited by our panel size. Mm-hmm. We don't really even know what we are looking for as we are understanding the resistance mechanisms, what the resistance mechanism may be as they emerge after treatment with a particular agent. So while I love liquid biopsies because it increases the rate of detectable mutations, I don't think we're quite there yet to apply it to a resistance setting easily.
Haas, what are your thoughts about how liquid biopsies change the landscape for repeat biopsies and informing subsequent treatments?
Again, I look at the liquid biopsy as an option that has made life a lot easier in the clinic for a patient population that couldn't get the biopsies done. I like Charu's data, as we just pointed out, the fact that you can increase, because sometimes the tumor is not accurate. You can pick it up in blood and patients still respond just as equally. So I like all of those approaches with it. In the resistant and the second line setting and all of that, I think we still have a lot of work to do, because these panels don't have the specificity yet to give us what exactly we're looking for. If and when we get there, and I'm very confident that we're going to get there, I think it's going to make life a heck of a lot easier. So we don't have to go through the repeat biopsies on at least a majority of these patients that we're dealing with. But we're not quite there yet in that particular setting.
I feel like we're all converging on that same concept that we can absolutely see how to get there from here, and the technology is only going to get better, as will the data to support it. But right now, having greater access to data we don't know how to use is not a great incentive just yet.